This week, as we mark 1 year since health officials declared COVID-19 as a pandemic, we're learning more about the healthcare workers who we lost along the way.
Yeah, new numbers show more than 50 people who worked in healthcare settings here in Arizona died as a result of contracting this virus. Carissa Planelp has more.
I'm told David Deneri was an X-ray technician who took the time with his patients to help them feel comfortable. His daughter says he died in December after getting COVID-19. She believes his death could have been prevented.
He loved being a grandpa. It was like his joy.
Jackie Deneri says her dad, David, enjoyed every moment with her little ones.
He was a very giving person.
The Navy veteran spent more than 30 years in the radiology field. Jackie recalls watching him interact with his patients at Tempe St. Luke's.
People smiled when he walked in the room.
In December, David got sick. Jackie insisted he go to the hospital.
I shouldn't have made him go. I didn't want him to go, but I knew that he couldn't breathe. That he was scared.
A week later, David Deneri took his last breath. The 57-year-old is listed in a database of healthcare workers and support staff who have died from COVID-19. The data, curated by The Guardian and Kaiser Health News, shows 54 healthcare deaths in Arizona.
When you don't know what's going on, it's hard to give guidance.
Dr. Ross Goldberg, president of the Arizona Medical Association. While it can be difficult to track how someone got COVID-19, Goldberg says there's no doubt our frontline workers have a higher risk.
When you're in the healthcare field taking care of sick people, you're going to be exposed to something more than the normal population.
He was somebody that you never in a million years thought that this is how he would go.
A year into the pandemic, Jackie says it's too soon for elected officials to give up on public health measures.
I think that if they had lost somebody, that this pandemic would have been like shut down.
Carissa Planelp for Arizona's Family.